On today's episode, I'm talking all about swollen nipples and phantom pregnancy in dogs. I'm then moving on to nasal irritation and runny noses before finally tackling the topic of rawhide chews and jerky dog treats. Are they the best thing and are they safe to give our dogs? But first, here's the intro.
You're listening to the Dr. Alex Answers podcast, the show that answers all of your dog and cat health questions so they can live healthier, happier lives. And here's your host, veterinarian Dr. Alex Avery.
Hi and welcome to episode number 16 of the Dr. Alex Answers show. I'm your host, Dr. Alex, the veterinarian behind ourpetshealth.com, where my aim really is to give you the information that you need to help you look after your pet to the best of your ability. And I'm so grateful that you're here sharing your valuable time with me. And if we're meeting for the first time, if you enjoy the show, then make sure that you subscribe and share the podcast with your friends and family. I've got loads more valuable episodes lined up that you won't want to miss. Now, you can also get your question answered to be featured on a future episode just by heading over to dralexanswers.com. And so let's jump into my first question from Katie, who writes that Maggie's nipples never went down entirely after her first heat at the end of February. So that's, maybe kind of 3 months ago now. We've never had a female dog before, so I thought that this was actually just normal. But today it got the better of me, and so I Googled it and have seen a range of horrible things. What's going on? Well, I'll start off by saying that, so this is a young dog. They've had their season, maybe 3 months or so ago. It's almost certainly going to be the result of something called a phantom pregnancy. Now, this comes about because the hormone changes in a female dog's body after they've had a season, so after they've been on heat. They're actually very similar regardless of whether they're mated and get pregnant or whether they're not pregnant. So the hormone changes are very similar, and that effectively tricks the body into kind of believing that it's pregnant, even when there's no chance that could be the case. That can show as a range of different things. So we can get changes in behavior. So that can be restlessness. It can be irritability. We can also get a reduction in appetite as well sometimes. We can then go on and get mammary development. So we can get enlargement of the nipples, enlargement of the mammary glands. And in some cases, we can actually get a lot of milk being produced. It's not unusual to have a few drops if you kind of squeeze those nipples and get a few drops of milk out. But some cases, some dogs can develop an awful lot of milk. And I think that's definitely the case if they're older, if they've had this a few times before, or if they have had puppies in the past. We can then also get nursing behavior in phantom pregnancy. So your dog might start to collect inanimate objects. So that could be socks, it could be toys, it could be shoes, and kind of nurse them, gather them together as though they're, these objects are your dog's babies. And they can actually get very possessive over these things as well. And that can, even lead to aggression in some cases. And then in other cases, we'll get an increased appetite and we'll get a weight gain as well. So that might even trick you even further into thinking that your dog's pregnant when they're not. Now, signs of phantom pregnancy, they typically come on at about 60 days after a heat, but that's really very rough. And some dogs, like Maggie here, will develop them and develop her kind of mammary enlargement just as soon as they come out of heat. Others, it will come on a little bit later, so maybe 3.5 months that they'll be developing these signs of a phantom pregnancy. So, there's quite a broad range, and it's really not that uncommon that this happens. Now, for those dogs that do develop phantom pregnancy, these signs do tend to get worse with each passing season. That's certainly my experience of it. So, that's something else to consider. If your dog is, becoming a little bit obnoxious, if they're becoming a little bit aggressive this time round, then next season that's likely to be even worse. Now, when it comes to treating this, normally, really, we don't actually need to give them any treatment. So it will sort itself out by itself without any intervention in a couple of weeks. So that would be the normal situation. Now, if you want to help that kind of resolution take place, you can increase their exercise, you can also reduce their food intake, and potentially even reduce their water intake a little bit, certainly if they're having a lot of milk, because that will then kind of encourage the body not to produce that extra fluid in effect. You need to be a little bit careful of that, but certainly increasing exercise and cutting back on their diet, generally is all that it takes if they need any help at all. Now, for those dogs that are showing severe signs, maybe they're getting mastitis, and I'll come on to that in just a second, or if there are other things that they're doing that we really want it to stop right now, then there are hormone treatments available that we can give that will, dry up any milk, and it will reverse the signs of phantom pregnancy. To be honest, I haven't needed to use this in any patient of mine for a long time, and it's not something we often need to reach for, but the option is there if there are particular concerns. Also, This condition does, like I just suggested, increase the risk of mastitis if there is milk present, and especially if there's a lot of milk present. And that'll be because the milk is being produced, but there's no puppies there to draw the milk off. So it sits there, kind of gets a bit stagnant, if you like, and that increases the risk of infection. Now, to know if your dog with a phantom pregnancy does have mastitis, you just need to feel along their teats, along their mammary glands, if they're kind of very warm, if it's becoming quite firm, if they're red, if they're painful, then that's going to really mean that mastitis is quite likely, and we should get them checked over to check that they don't need any antibiotic treatment for that. Now, when it comes to eliminating the risk in the future, really spaying them is what's going to need to happen. There's no other way that we can eliminate this risk, short of giving them drugs to stop them coming onto heat in the first place, which isn't necessarily the best idea, because that could potentially increase the risk of pyometra. And that's a condition that I've discussed several times over on the Our Pets Health podcast, or over at ourpetshealth.com if you're interested in learning more about pyometra. But, spaying is definitely something that we should think about. Certainly if you're not planning on breeding from your dog in the future, then getting them spayed is going to be a good idea. And if you're wondering about timing of spaying in general, if you've got a younger dog, or if you've got a dog who's not yet either gone through a heat or gone through this problem, but you're thinking about spaying them and you're wondering about timing, again, head over to ourpetshealth.com, where I've got a full review about timing of spaying in dogs. Now, that's said, what the most likely thing is going to be in this young girl. But swollen glands can also be a sign of other problems. So it can indicate mammary cancer. It's generally a condition of older dogs, or certainly middle to older age dogs. It can be in a little bit younger in some cases. Pretty unlikely in Maggie's case, just because she is so young. Now, we can also get swollen glands, obviously, if a dog is pregnant and they're actually coming into milk because they're about to give birth. So that's something to think about. And then mastitis, like I say, can cause swollen glands. But that would be maybe in a dog who's already given birth, and the glands are just getting a bit firmer than they have been, or like I say, a dog who's got phantom pregnancy, and the glands have got infected that way. So that's really a rundown on phantom pregnancy. It's something that's really not that uncommon. It often doesn't need any treatment, but just keeping an eye that the mammary glands aren't getting swollen, they're not getting firm, and they're not painful, and everything should sort itself out. Of course, if you've got concerns, if you're not sure what's going on, if the glands are swelling up, if the nipples are swelling up and you don't think your dog's been in heat, then definitely getting checked over by your vet is going to be a good idea.
You're listening to the Dr. Alex Answers Show.
And then before we get into the next question, I just wanted to let you know that this podcast episode is brought to you by the Our Pets Health Knowledge Vault. So this is the free pet health resource library, which contains a wealth of checklists, ebooks, calculators, and guides to all sorts of different conditions, all designed to help you and your pet live a healthier, happier life. So to get access today, simply head over to dralexanswers.com. My next question today is from Amanda, who lives in Mauritius, and she's got a little griffin dog, and she's pretty sure that she has postnasal drip. And it sounds like she's also got phlegm at the back of her throat. So what would I recommend to soften up this phlegm and to kind of get rid of this problem? This little dog is also prone to allergies, and the vet has prescribed an antihistamine. But Amanda's not a fan of all things chemical, and so she's tried adding turmeric and cocoa oil to her little dog's diet. She also notices that when she gives her a spoonful of honey, it seems to just help her to clear her throat, to do a little gag, and all seems to clear up. So can I give some advice to help in this case? Well, I'll first start by saying I could do with some honey. So I'm suffering from a bit of a cold at the moment, so apologies if I sound a little bit funny. But yeah, let's get into this dog's question and this dog's problem. So a chronic nasal discharge, it can be caused by a number of different problems. And I don't think, most of these are going to be even a concern in this dog. But just to quickly run through them, we can get fungal disease. Now that's more common in long-nosed dog breeds and in tropical climates as well. That generally causes a snotty or bloody discharge, and it's normally from one side, at least initially. We can get foreign bodies, so something that's been snorted up into the nose, like a grass seed or a blade of grass or a bit of stick or something like that. Again, we tend to get a snotty, bloody discharge, again, that is one-sided from one nostril, unless multiple things have been snorted up, each side of the nose. Now, we can get nasal tumours, so tumours in the nose, and actually, if you, are interested in hearing more about that, then check out episode number 14 of this this podcast for a full breakdown of nasal tumours in dogs. And then finally, we can get allergic and immune-mediated disease causing kind of a chronic long-term inflammation within the nose, causing something called chronic rhinitis. And chronic rhinitis is also known as postnasal drip in humans. It's not a term that we tend to use in dogs, but yeah, that's kind of the human term so for this chronic rhinitis. Now, you notice that I didn't say infection there, and that's because infections in noses are generally not a primary problem. So they're not normally the main problem. We can get infections up noses, but they normally come because there's something else going on. So because there is a long-term inflammation because of an allergic disease, for example, or because there is a foreign body up there, or because there is a tumour, can then result in an infection which will respond to antibiotics, but they don't tend to be the first thing that we think about. And if a dog does have an infection and responds to antibiotics, we still need to be thinking, what is the underlying cause of that? So what can we do for diagnostics? How can we go about diagnosing what the causes of a nasal discharge are? Well, really, we're going to take a good history, what's going on, how long's it been going on for, has it fluctuated and changed in severity, did it come on very quickly, has it come on slowly, is it only a problem at certain times of year? We can do blood tests, we can take a swab of the nose, so stick a swab up the nose to have a look under the microscope and to see what grows in the laboratory. We could do x-rays, we could do CT scans, biopsies, so there's lots that we can do, and the nose can be a frustrating and difficult place to try and find out what the underlying problem is. Now, we can also give a treatment trial. So that could be, for example, antibiotics and steroids if we think we've got an allergic disease or an immune mediated problem, and then monitor the response to that. And that's especially going to be appropriate if this is maybe the first time that that we're seeing the problem and it's not been there for a long time, or if it's very mild disease and there are no other concerns on examination. And really, the best treatment is going to depend on the underlying cause, what's going on, so that we can tackle that. And you can tell from all of the potential different causes that the treatment for each is going to be very different. Now, I think allergies are going to be the most likely problem for Amanda's little griffin here. Given the history, given the presentation, the fact that there's, general allergies and she's responded well to antihistamines in the past. So, we'll start off the kind of what can we do to clear the mucus? Well, the first thing to clear any mucus that's going on in the nose, or if it's kind of going on down, if your dog's got a cough and they've got like a chronic bronchitis, then the same applies. We need to ensure that the dog is well hydrated. So that will just help make sure that the mucus is kind of nice and moist. It's not kind of really thick, and so it's more easy for the dog to kind of express it, to expel it, and to kind of shift it and move it on. So we can ensure hydration by feeding wet food, maybe by adding water to the diet, by putting ice cubes in the water, maybe a little bit of flavour, a little bit of a stock cube or something like that. We want to avoid anything with a lot of salt, so low salt stock cube, or boiling up a little bit of chicken or vegetables or something like that, just to give it a bit of flavour. Refreshing the water regularly is important. Running water is another option. Some dogs will really enjoy drinking from running water, and that's where we can then use a pet fountain as well, just to help with that running water. So ensure that hydration. Next up, we think steam. So if we're all bunged up, then we feel better after we've had a kind of a hot steamy shower, or if you put your head over a bowl of hot water, that steam will just help. Again, that really helps just get into the mucus, to help hydrate the mucus and allow it to kind of flow and be shifted much more easily by the body. So we can do this for our dogs by taking them into the bathroom while you are having a hot shower, so that they're in that steamy room. Now, there are also medications that we can give, certainly in the short term, to help shift the mucus. So something called bromhexine, may be beneficial. We tend to think of that maybe more if we've got a really mucousy kind of airway. So if they've got a really mucousy cough, so like a chronic bronchitis rather than a nasal problem. But that might be something to think about. And then honey, that may help soothe the throat irritation. It's something that many people will claim. I suspect if it does have a benefit, it's fairly minor, but there's not really going to be any harm to giving that go. And if you feel it's beneficial, then, sure, keep giving it. Now, as far as turmeric goes, well, curcumin is actually the active ingredient that is found in turmeric. And curcumin, it does have an anti-inflammatory effect, But, and there's a big but here, it's only found in very low levels in turmeric. So to get any potential beneficial effect of the curcumin, you'd have to feed an awful lot of turmeric. So, that's something to consider. And I think just a little sprinkle here or there is really not going to make any difference. And also we need to bear in mind that there's no real evidence of benefit as such in dogs specifically. There is wider evidence that that curcumin can have an anti-inflammatory effect, but I wouldn't hang your hat on giving a turmeric supplement and that having any kind of really beneficial effect. Now, if we're talking about drugs, and I know Amanda says she doesn't like chemicals, but, drugs are only kind of isolated natural compounds in many cases, certainly not all. Some are completely lab derived, but, we purify things and we actually take away potentially kind of the harmful or the unnecessary things and have something that causes kind of just a single effect. Now that's, obviously you may disagree with me on that, and some drugs very much don't fit that bill, but antihistamines in general, they're very safe in dogs. There's no real long-term problems that we need to think about in the vast majority of cases, and really they're fine for long-term or for intermittent use. So if it works in this case, then really it's going to be much preferable to any other drug. So some drugs do come with more side effects. Now if we're thinking of allergic disease, often we'll be thinking of steroids, and steroids do come with a higher risk of side effects. So I've actually discussed that separately over at ourpetshealth.com. So if your dog is on steroids, or you're thinking about starting them on steroids because that is all that helps them, then definitely check that out. But antihistamines, they're generally very safe. They work well. The side effects are very few, and there's no long-term concerns. So it really depends on how much of a problem this is causing to Amanda's dog. If they've just got a bit of a runny nose, otherwise they're happy, a bit of a cough, but we can mobilize that in other ways, and that seems to just help keep things at bay. They're not getting any, this dog's not getting any secondary infections because that mucus is building up. Then it may be that we don't need to give any treatment or specific treatment at all. But I think to say that we can completely disregard all treatment for everything, is maybe a step too far. We certainly don't want to be giving anything unnecessarily, and that's why I say if this dog is able to be managed without treatment, fantastic. But if we do need drugs at set times, or to keep things under control and avoid potentially then intermittent antibiotic treatment or long-term steroid treatment, then we should think about that strongly.
Get your question answered at dralexanswers.com.
And now's the time when I just remind you that the information that I give in these podcasts is not a substitute for a consultation and examination with your pet's veterinarian, and really should not be taken as specific advice for any individual pet. If your pet is unwell, if they're injured, or if they're suffering from any kind of problem, then talking to your vet is always going to be the best course of action. And then my final question today is from Sophia, who writes, can I safely give my dog low-treated rawhide, so chemical hair removal but no bleaching or splitting? And what about pizzle sticks and other dried meats or chews? How about softer bones such as lamb ribs? Well, I'll take that last one to start with. So softer bones, they are unlikely to cause fractured teeth than the weight-bearing kind of long bones of our kind of cows and sheep. But, if they're raw, then there's still going to be an infection risk. And really, if you're thinking of feeding raw or giving bones, then check out my free ebook over in the Knowledge Vault, which discusses whether this risk is something to worry about, in a much greater detail. Now, if instead actually you're cooking these, so we don't have that risk of infection with raw food, then the ribs, they're still going to be brittle, and there's still going to be a chance of blockage and perforation. So, they're not something that I would tend to recommend at all. Now, rawhide chews, let's move on to those. So they're processed skin, generally of cows, but could be of sheep as well. And they're typically a byproduct actually of the leather industry. So not the meat industry, of the leather industry. And there's various ways that the rawhides are produced, but generally they do involve a lot of rather scary chemicals, to separate out the hide layers, to preserve them, to cure them, to flavour them and colour them as well. So that's definitely something to think about. Now, Sophia's talking about low-treated rawhide. It depends on what's used to treat that. To remove the hair. What's used to preserve it, to kind of keep it fresh-ish before it's then processed. So, there's quite a lot there. and that's really going to depend on the source and on the specific manufacturer as well. So if it's come from a long way, so if it's kind of shipped in from China, which is where a lot of them are produced, then really they are probably going to have had a lot of chemicals to process them and to get them to you in the first place. But if it's a local manufacturer, then maybe you're more aware of what's going into them, and you can make that decision for yourself. Now, if we think of rawhide chews in general, apart from kind of all of these chemicals and things, what are the other potential problems with feeding them? Because a lot of dogs will really like them. Well, they do still have a risk of obstruction. So I spoke about the risk of bones getting kind of swallowed and then stuck in the intestines, but rawhide chews definitely have that risk as well. Really, especially if large chunks are swallowed. So this is going to be more of a concern if your dog is a real power chewer. So if you've got a dog who's got a really powerful chew, they really go for it when they get a chew, and they're able to bite off big chunks, even whole ends. So if we think of a rawhide chew, a lot of them will have a knotted end to make them look a little bit like a kind of cartoon bone, if you like. Now, if a dog's able to bite that off and then swallow it, then there's a real risk that could be causing an obstruction later on. So it could get into the stomach and then squeeze its way into the intestines where it becomes stuck. Now, even if that doesn't happen and it stays in the stomach, it can take a long time for these rawhides to get broken down into the stomach, and so that can cause long-term irritation, vomiting, diarrhea, all that kind of thing as well. So, that's definitely something to think about if you've got a power chewer. Now, if we then move on to kind of raw meats and jerky treats, well, there have been concerns with some jerky treats actually causing kidney failure and death in some dogs. Now, the cause of this is unknown. It really does seem to involve treats that have been imported from China. Now, we got similar things when there was a melamine contamination in some pet foods back in 2007, I think it was. That hasn't been specifically implicated here, and there may be other problems as well that are causing this kidney failure. But, I think it just highlights that, with a lot of these things, there's potentially something that we need to consider that may make it dangerous. Now, that's not to say all of these treats are dangerous by any stretch of the imagination. Again, if you've got a locally produced, kind of minimal chemically produced dried treat that you want to feed them, fantastic. Now, you can even make kind of jerky treats and things yourself if you're, if you're that way inclined, and then you know exactly what's gone into it. Now, as an alternative to all these things, what can you give your dog instead just to keep them entertained, to keep them happy, and to give them a kind of a rewarding treat? Well, consider Kongs. So the kind of the big rubber toys that you can then stuff with food, or you can smear with a little bit of peanut butter or something like that to really cause your dog to kind of work, to chew away, and to get a bit of a tasty treat reward as well. You can use snuffle mats. You could use food puzzles, licky pads. So there's a number of other things that we can use that, will keep your dog entertained. It will provide them with a food treat, a tasty kind of reward, but will also provide a good level of mental stimulation as well, which is very important for the well-being of our dogs. So, rather than, potentially rawhides or some of these other treats, especially if they have come from, maybe more uncertain, less local sources, really consider whether they are the best thing to be feeding your dog. And then the other thing to think, if we are giving food treats, is, treats are great to give, but, rewards for our dogs doesn't have to be food. It could be just your attention. So rather than giving them something tasty to reward them or to give them a treat, give them your attention instead. So play with them, take them for a walk. Also consider, how much you're giving, because if you're giving a lot of the treats, then, the chances of obesity is going to be much higher. And obesity is a massive problem in our pet population that has a really significant knock-on effect in their general health, their well-being, and also their life expectancy. So, that's just another thing to think about when it comes to giving treats to our dogs. So that's it for episode number 16 of the show. I'd love it if you share it with your friends and family to help me spread the word to help more pets. And remember too to head over to dralexanswers.com where you'll find the links and downloads mentioned in today's episode. And while you're there, you can also submit your question to be featured on a future episode. But until next time, I'm Dr. Alex. Take care.
You've been listening to the Dr. Alex Answers podcast. Be sure to rate, review, subscribe, and we'll see you on the next episode of the show where you ask the questions and Dr. Alex answers.